Dr. Epstein here. I want to talk about options in anesthesia for hair transplant procedures. As we are a plastic surgery practice that regularly performs other plastic surgery, I strictly do hair, but we have several surgeons here that specialize in both rhinoplasty as well as in aging face surgery. In fact, the case is going on behind me. But basically, we're able to offer twilight sedation. What is twilight sedation? Basically, it's similar to what's done for a colonoscopy, for example. Typically, the anesthesia is provided for the first 6 to 7 hours or so of the procedure, maybe as much as 8 to 9 hours, during which time the patient is basically sleeping, is awake, breathing on his or her own, but really feels nothing and remembers nothing. And this allows most of the procedure to be done that way. And towards the end of the case, for the last hour or two, we will basically shut the IV sedation off, or as we gradually taper it. And this way the patient still feels nothing, still has sedation on board, but is not under a deep anesthesia, both for safety's sake, as well as to allow the patient, by the conclusion of the case, to be able to walk out of the office. Hey, Rick.
Yeah.
This is Rick.
So,
Rick and I
hi.
have been together a long time. Rick, introduce yourself and
So,
talk a little bit about IV sedation.
I'm Richard Gonzalez, a CRNA, and so like Dr. Epstein mentioned, it's very similar to the medicines that we're using are very similar to what you would get in a colonoscopy type surgery. So it's propofol essentially, and very light type sedation, but patients usually semi-conscious, and we're able to adjust the anesthesia according to how the patient wants to feel. So that's the best part about it. And one of the other dynamic features of the propofol is that when the patient wants to wake up, it's like a light switch effect. We basically turn it off and the patient's wide awake, or we can titrate it so that the patient feels more sleepy. However, the patient would like the sedation, we can manipulate it in that manner. And it works very well. Patients are awake. As soon as the procedure is done, they have lunch and they're off very fresh, able to go home and enjoy the afternoon.
Yeah, we have a lot of patients that that choose to have it done this way. Certainly there's, probably if I was having a procedure, I would have it done that way too. Just come in, get knocked out, and 5 o'clock in the afternoon, end of the day, you're all done and you really don't remember anything and you don't have any discomfort.
Yeah.
Now, alternative is oral sedation, usually a combination of Valium and Ambien, as well as Pronox or nitrous oxide. You breathe in laughing gas at the time when we numb up the patient. So the oral sedation basically keeps them nice and relaxed, and sometimes taking a nap, particularly if they take Ambien. Meanwhile, the local anesthesia will provide basically complete anesthesia, so you don't feel anything. Anyway, options in anesthesia for hair restoration surgery. This is Dr. Epstein. Thanks, Rick.
All right, you're welcome. Have a good day.
Thanks.